Sexuality in women is not only limited to pleasure, but also as a means to create a new life.
Many women are engaged in the sexual activities for the sake of their partner's wish because women are more passive towards sex, and they are constantly under the stress of the possibility of undesired pregnancy. This sort of psychological burden can lead to sexual troubles, but they are often neglected because it's not apparent as the problem in male. We'll examine the female sexual concern in this edition of the Oriental Medical Digest.
Female sexual disorders are on the rise. Not only they lack desire for sex, they complain pain during the sex accompanied by bleeding. According to one survey, 1/3 of American women have felt pain during the sex, at least on one occasion. Another 15% proclaimed this continuous but repeated pain cycle within a year.
Male sexual disorders such as impotence and premature ejaculation can be easily observed, but female problems are often neglected because the signs are vague. But if one continues to disregard female sexual concerns and engages in sexual conduct, it'll lead to possible sexual evasion and colpospasm. This can cause serious problems in the relationship.
This instrument is a meridian diagnostic analyzer. We need to know the condition of each organs as well as how they interact with different organs. This test is done by measuring the 6 meridians in each of the 4 extremities. Sensor is placed on the representing trigger points of the 12 meridians to analyze the condition. Meridian Diagnostic Analyzer can detect the disharmonious status of the functions, which are undetectable through the biochemical evaluations. Curve on the graph is constant for a healthy individual, but an individual with specific regional abnormality shows abrupt curves. First choice of treatment is acupuncture. Invisible energy known as qi or life force flows within the meridian. When the flow of qi is obstructed, an acupuncture needle is inserted to invigorate the circulation of qi.
For the deficiency of yang energy of the kidneys, a treatment is carried out to revitalize the kidney yang energy. The first point is Guanwan, located 3.5 centimeters directly below the umbilicus, which raises the kidney energy upwards and alleviates chilly extremities. Gihe, located 7 centimeters below the umbilicus, strengthens the reproductive system and relieves nervous prostration. The next point is Ki-mun, about 20 centimeters below the breast. This point is known to boost the yang energy in the liver. Gansu is placed 3 centimeters bilaterally away from the spinal process of the 9th thoracic vertebra. This strengthens the overall functions of the liver.
One of the fundamental issues in female sexuality is that they do not express their intention for unwanted sex. Strong expression for unwanted sex will not only provide physical or health management, but also acknowledges the importance of their existence to the partner. And if the couple participate in the treatment together, it will lead to more constructive results.
Second treatment method is an herbal medicine. 4 grams of prepared sukjihwang is prescribed to tonify the blood and strengthen the reproductive system. Tanyak fortifies the weakened energy of the spleen and lungs. Sansuyu invigorates the kidney and liver energy. Lastly, mukdanpi lowers the heat in the extremities. All of the above herbs are prescribed 4 grams each. A natural herb such as mugwort is heated to warm the affected area, which promotes the healing efficacy by increasing the leukocyte counts in the area. Just as the blood flows within the vessels, energy flows within what is known as meridian. A meridian is chosen depending on which internal organ is treated. For this case, a patient does not have enough blood supply in the heart and spleen. First, place a moxa cone on kansu, effective for recovering the depreciated functions of the liver. Second point is choksamli, good point to boost the energy in the legs and waist and helps the digestive system. Last point of the moxibustion is chungwan. It lowers excess heat in the heart.
Sex during the menstruation period may cause endometriosis. It is recommended to avoid having sex during the first 4 months and the last 6 weeks of pregnancy. Even postpartum, it's advisable to avoid sex for 6 weeks because the reproductive system hasn't yet returned back to its normal status.
It is humans' natural desire to practice sex, and good sexual relationship plays enormous role in maintaining a solid familyhood. Healthy sexual relationship is perhaps the best way to keep intimacy among the married couple. Women now need to take an initiation if there are problems in the sexual life. Thank you for joining us today. I'll see you again next time.